Conversational AI in healthcare. The healthcare sector is often the last entity that embraces technological revolutions or updates because of its dependence on human-to-human interactions. However, COVID-19 has forced this sector to collaborate with AI, especially conversational AI applications, to maximize its efficiency too. Why is AI still not promptly used in healthcare? Whenever a patient visits any hospital for any sort of treatment, they expect a human, not a bot, to interact with them. This is because most patients are already anxious and frightened of medical procedures, which more often than not happen to be physically, emotionally, and economically taxing. In these circumstances, any kind of empathetic interaction between patients and professionals acts as a form of solace. This is why the integration of chatbots and virtual assistants have been slower in hospitals and clinics. COVID, a recipe for change? During the pandemic, healthcare services were disastrously strained with an immeasurable workload and short staffing. This meant the quality of service being provided by hospitals was quite compromised, and this is exactly where the efficiency of conversational AI was best optimized. Conversational AI, with the unique combination of NLP, or natural language processing, and ML, or machine learning, has created a system that is far more nuanced and effective than mere chatbots. This constant feedback and improvement loop has made this AI competitive and a favorite tool for many industries. Uses of AI in healthcare. Particularly in the healthcare sector, the use of conversational AI-driven chat boxes has been a textbook example of success. For example, these VAs can help patients take medications on time, be present for routine checkups, record any symptoms or abnormalities, among other issues. This is especially helpful for elderly patients or patients with a disability, as it makes continuing healthcare services more stress-free. Conversational AI can also help with employee training and onboarding. This makes the process more efficient, and healthcare companies have to use less manpower on the quite overwhelming tasks. However, it's worth noting that human-to-human training is also still exceptionally useful, as actual interaction can help stress newcomers. In conclusion, conversational AI in healthcare is here to stay, and with the rapid growth in technological advancements in AI, it's safe to assume that we can expect a future healthcare system that optimally collaborates with AI further to transform medical experiences once and for all.